Before we begin, Tracy, do I have your permission to record this video for therapeutics intervention to assignment?
Yes.
Okay, so we're doing a functional movement assessment on and posture on a D2 female basketball player who's been experiencing pain in her left with chronic ankle instability from previous years of injury. So what I would do is I would first see how my athlete is walking into the training room, athletic training room, and to me, she came in walking with slightly favoring her right leg because she's been experiencing all that issues with her left. And then I would have her stand up for me, get up, and then I would first check the front, see how she's doing. As you can see, she's favoring more of her right leg than her left, which is the one that's been injured. Um, Kind of look at the shoulders to see how they are. To me, right now, they look pretty even. Nothing looks different from either one. And then you can check the iliac crest and see how they're resting. It looks like they're resting the same. And then you check from the side. It looks like her posture is aligned. Her head looks to be slightly pushed more forward to the front compared to the alignment of her body. And then you check the back again to check the shoulders. Also check the iliac crest from the back. Again, they look the same. And then you can do okay, and bring it back down. Bring it to the side. Down. Bring it back over. Okay. Good. Down. She is not experiencing any scapular weaving, so what this assessment would do would basically be checking to see how her posture is compared to what it should normally be. She will, from right now, she's looking to be perfectly fine, normal ranges. The only thing we had to look for is her head posture. Well, I had to work on that, kind of getting those neck muscles to move her head back more, get more stability in there. Next, what we would do would be a single leg squat. So you can do a single leg squat for me as much as you can. Start with your right leg so you can compare bilaterally. So you're going to be left leg out, kind of squat as far as you can on your right leg. And then repeat on the left leg for me. All right, you can notice a difference because she has no balance in her left leg as much as her right leg, and she's kind of tilting to the side. So what this would do basically will help us assess how she is instability. You're noticing the instability in her left leg compared to her right leg. And what I would do for this is I would take more note of it, be aware, especially line up their normals for day reporting. And then the next we would do is just kind of figure out how we can manage this. For now, we'd probably just do some modalities, cryotherapy, ice, and electrical stimulation, just to kind of calm down any pain she's experiencing from the ankle. And then before any practices or any competitions, you probably place a heat pack just to kind of warm up those muscles. While I do some ankle instability exercises, four-way inversion, eversion, plantar flexion, dorsiflexion, kind of work her strength, increase her range of motion. While I do those every day, and then after we probably put some tape instead of normal tape. We probably do more of an elasticon to provide more support, make it more sturdy for her. And then we'll just take it day by day. More so, we're trying to stop the pain right now first, and then after her pain has been managed, we're going to work on creating more strength and more stability in your ankle. And so for this patient, depending on how severe the pain is, I would recommend the only medication would probably be inflammation medicine, NSAIDs, possibly ibuprofen. I would first make sure that she's not allergic to anything, and then just kind of tell her to be aware of how often she takes it, no more between 4 to 6 hours. And then after that, I would use a patient report outcome measure. I would use FAOS, just to kind of report. I would probably use it every 3 weeks, see where we're at, kind of ranging. And I'd probably use a numeric pain scale just to range her pain probably at the end of every week.